Alrighty, so we're going to be doing a inspection of the GI tract, and first you start off with inspection. Look for any discoloration, scars, stretch marks, anything that's not really supposed to be there. Alright, so then there's 4 quadrants of it split up by the umbilicus. You got the left upper, left lower, right lower, then right upper. So we're going to go into the auscultation of that, listening for any gurgling, sounds of bowel movement, anything like that. And you start off with the diaphragm, make sure it's on the right side. Alright. And if you didn't hear anything, which I did, I heard some gurgling, some normal bowel movements happening. If you didn't hear anything, you'd have to wait another 5 minutes to get a good read of if anything's actually going on. So next thing we're going to do is we're going to go through the different palpations. And the first palpation is a light palpation. So what you're feeling for is tenderness to palpation. And just going through the quadrants again. You're going to be using one hand, making sure all your fingers are together like this. And when you go, you do nice little swirls. Again, you're looking at your patient's face, seeing if they're making any wincing or anything else. Next, we're going into a deep palpation. So you're going to be using 2 hands. The bottom one's relaxed. The top one's going to be the one applying the pressure. For this, you're kind of just feeling for masses, and yeah, so. Alrighty, so no masses, really. Next thing is the special palpations. The first one is for the liver. You're gonna first start fingers together, swirl, do that same swirl motion, and slowly move up into the rib cage, trying to feel for that liver. So I'm gonna go on the other side so you can see it. So with that, when you feel the liver, then it's a larger liver than normal. Next technique is you're gonna go in kind of similar, and go over the top. Have your patient breathe in. That should push the liver down into your fingers. Can I have you breathe in? Relax. Yeah, same thing, you might not feel it there. If not, there's another special test where you do the hook test, where you get up underneath the rib cage.
Special test.
Where you get up underneath that rib cage, have them breathe in again, and the liver will get pushed down by the diaphragm as well. And then the next one is you're feeling for the spleen. Normally you're not going to feel this because the spleen's farther up there than the liver. And if you do feel it, that means they have 3 times like larger spleen than normal. So what you're going to do is reach over, lift up the rib cage. Same thing, going at a 45-degree angle. feeling for that spleen. And if you don't feel it, you don't feel it. And then the next thing is percussion. Going through, making sure your fingers, the distal end of the joints is flat.